So, you've had your hip replacement surgery. What's next? Well, recovery is part of the process where you, the patient, have a great deal of power. Generally speaking, your big tasks are healing and physio. Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacements. Your medical team will ask you to keep an eye on your wound and let your doctor know if there are any issues. You will follow the advice of your physio. This may look like exercises of bending and straightening your hip and your knee, and the more intentional you are working, the better you will be in the long term. To give you a more detailed sense of what recovery may look like, I'll review common questions I get from my patients. What do I do if my wound starts bleeding? Don't be worried. Most wounds bleed a little bit, especially for the first 2 or 3 days. That's partly because you just had surgery and partly because we're giving you blood thinners. I recommend you just cover the wound tightly with a fresh dressing. Your hospital will often send you home with some dressings. Otherwise, you can ask a loved one to go and get some from the drugstore or the pharmacist. Simple gauze and white adhesive dressings are probably all you need. If the bleeding continues to go on for too long, I recommend contacting your surgeon's office. They may need you to stop the blood thinners for a little while. If it's after hours for their office, you must make the decision. If you're worried, you may decide to go to the local emergency department, or you can use a pressure dressing like the one I just recommended above and see if it stops the bleeding before you decide to go to the emergency department. What is the pain like after a hip replacement? Have you ever had that tender, bruised feeling? Maybe you've taken a tumble on the ice and landed on your butt. Or if a sports opponent has kicked you really hard in the leg or the thigh, maybe repeatedly. You know, you hobble around for a while, you slow down and bruise. But usually it goes away after 2 or 3 weeks, and it's getting better day by day. That's what I tell my patients a hip replacement feels like. It's that bruising, kicking feeling. How long is recovery? Everyone is different, so I like to say it's a bell curve. Some people are almost pain-free at day 2 or day 3, but then there are those who still have some pain at 6 weeks after surgery. Most people, however, recover between 2 and 4 weeks, in that middle of the bell curve. What if my pain isn't controlled on the tablets? This is a simple fix. Take more painkillers, as long as you haven't gone over your recommended dosage. If you haven't had any of the prescribed opiates, these are the morphine type meds, because maybe you're worried about them, then try a small dose. You can keep increasing the dose little by little as long as it's within the recommended prescription. Of course, you're right to try and get off those meds as soon as possible. You can take Tylenol or acetaminophen with most opiates, and that will help. And most of you will be able to take anti-inflammatories like ibuprofen or Advil and Celebrex. But once again, please check with your physician. If you're still struggling with pain, even though you've upped your meds to a safe level, don't go beyond that. At this point, you should contact your surgeon's office or even your family doctor. When can I drive? There is no universal answer to this, I'm afraid. It varies from practice to practice, so it's important to speak to your physician. One thing is true, you must feel safe enough to drive and do what's called an emergency brake. That means slamming the brakes on at a moment's warning if a child runs out in front of you, if you have pain or are taking painkillers, or your reaction speed is delayed, and do not drive. It's important to be honest with yourself. Your reaction speed decreases after a joint replacement in the early period, and if you're not quite ready, you could cause harm to yourself or other road users. I typically let my patients drive after 2 or 3 weeks, as long as they meet the health criteria mentioned before. You'll need to consider if you have an automatic or a manual, if it's your left leg or your right leg that was operated on. Another important thing to do is consider your insurance. Just check in with your insurer to make sure they're covered under your policy. When can I fly? Flying can potentially increase the risk of developing blood clots, the DVT and PE we talked about earlier. And you're already at risk of blood clots from the surgery itself. So combining the two can potentially increase the risks even more. I typically recommend patients avoid flying short haul, that means less than 3 hours of flights, for a couple of weeks, and avoid long haul, longer than a 3-hour flight, for a total of 6 weeks. Though there's not much research behind this and the evidence is scarce. In fact, there's only one paper out there that shows there's no increase in blood clots in patients that fly after hip replacements. But I just want to let you be aware of the potential risks and make sure you're taking the recommended blood thinner while you fly and for a couple of days after. It's also essential to check your insurance. When can I return to work? Well, this very much depends on what kind of work you do and how quickly you want to return to work. If you have a desk-based job, you can start work almost straight away. Most of the patients start within a day or two. Some extreme folks are working the evening of their operation. Obviously, they're working from home. If you want to go to the office, the limiting factor is getting to and from work. So if you can get a ride, then you could go back to the office whenever you want. Then follow the advice we provided about driving yourself. If your job involves manual labor, strange positions, standing, carrying things, or is in any way physical, I recommend you take about 6 weeks to 3 months before you go back. You must let your tissues repair. The replacements need time to bond into your bone. Again, this decision is up to you and your surgeon and your work. It's worth making an agreement before your surgery. But typically, if your job is very physical, I suggest a 3-month recovery before returning to work. Many of my patients want and need to go back as early as 6 weeks for financial reasons. And I am usually okay with this. But again, check with your surgeon. What will an infection look like? There are some obvious signs of infection you should watch out for. Things like pus, redness, or a throbbing pain at the wound. But just to warn you, it's pretty normal to get some redness, some heat, and some swelling, especially if you've had a knee replacement. So don't be overly alarmed. However, you should be concerned if the wound starts to come apart, if the discharge stops being clear or bloody and is more like a thick white or green discharge. If you start to get a persistent temperature, it's time to seek help. Please don't start antibiotics until your surgeon has suggested you do so. Your surgeon will want to confirm the bug. PROMS. PROMS stands for Patient Reported Outcome Measures. When we do an operation, we want to see how well it's done and how well you're doing. And one way to find out is to ask you questions about your day-to-day activities, the level of pain, and how you're feeling generally. Different surgeons have different questionnaires, but you'll fill out the same PROM questionnaires before and after the operation. I know it can sometimes be a pain to fill these in, but it really does help us surgeons monitor how you're doing, and it lets you patients know which surgeons get great results and which could do better. Joint recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.